soon as I got to the Bahamas, my stomach started to ache.
By the time we got to the hospital, he was double over screaming.
The doctors had told me that my appendix had burst. When I woke up from surgery, the incision was literally over a foot long.
Jake joins us now, and Jake, first of all, I just want to say sorry you went through all that.
Thank you.
Pain that starts like a light switch that goes like this, that's lateralized to one side or the other and radiates into the back or the groin is classic for kidney stone pain.
And they initially thought that.
And we don't do exploratory abdominal surgery for kidneys.
They did do an X-ray.
And the X-ray, they're like, well, it could be a kidney stone. And then they determined what could be a bladder stone, and then that wasn't it. And then the surgeon came in a couple hours later and said, it's your appendix.
Well, and for the record, an X-ray won't show you a kidney stone.
Right.
We knew. I kind of realized that by what you could see on just by looking at it.
I know you came back to the States and had another exploratory surgery. Was there anything that they found here that would have convinced the docs here that that exploratory surgery was necessary in the first place?
No.
And when they went back in, they in fact found an intact appendix.
Appendix
it was lying
intact.
in back of the colon, so-called retroappendix.
Correct.
But the appendix was still there.
And healthy. And the doctors couldn't even determine what they actually did. We still don't know what they did.
I think the things that are red flags, because I want, Jake, you to be a lesson, is the hospital was filthy. You're getting your dressings changed in a utility closet.
Yep.
You know, these are all red flags that we've even heard stories here in the U.S., people doing procedures in apartments.
Yeah.
And look, these things should never happen. If you're in a hospital anywhere and it's dirty, you know, this is just one of those tough situations. And I think hopefully everyone out there will now think through this. If you are going on a vacation, whether it's a work vacation like yours, have a plan in place. You need to have a plan in place. Know where the local hospital is. Look it up. Is it a decent one? Is it not? I actually will say this for you, Jake. I am actually feeling now after this whole thing went down that you're lucky, because you could have died there.
That's what the doctor said when I got back.
The beauty of this is, you know what? Scars, physical scars can heal. We actually sent Jake to see board-certified dermatologist Dr. Sonia Batra with the issue to look at this scar.
I'm just going to take a look. It's been about 3.5 months since all of this happened. What strikes me is that the scar is very firm, and it's really hard. It's also widened. It's caved in. It's really pretty depressed.
It feels like I have 2 different belly buttons.
Functionally, when you cut into that muscle, it makes it very painful but also very weak. You can't even sit all the way up without wincing.
There's a lot of pain behind it.
What I'd like to do is treat this so that you can move forward. Well, my treatment plan would be a combination of silicone sheeting to help soften the scar, as well as injections of a dilute solution of cortisone, which will help it become softer as well as a little bit less itchy and more flexible. I'd also recommend treatment with a vascular laser that's going to help with the softness as well as the redness, so it's not a visible reminder for him every time he looks in the mirror of the ordeal that he went through.
Well, Jake, you shouldn't have gone through this. Dr. Batra actually created a treatment plan. We arranged for you to see board-certified dermatologist Mohiba Tareen in Minneapolis.
Really?
Dr. Tareen is actually joining us via Skype right now because I know Dr. Tareen wants to share something with you. Thanks so much, Dr. Tareen, for being with us.
Oh, my pleasure. I am your local dermatologist in Minnesota. I'm so excited to treat you. I absolutely agree with the treatment plan. We're going to begin with some gentle injections and do those silicone sheets. Once everything's nice and flat and smooth, then we've got a variety of lasers that will help everything get less red and make everything kind of just blend in with the normal surrounding skin. And the most important thing is to help you get through this. We are going to provide this to you all free of charge.
Thank you. You're welcome. You're welcome.
Jake, what's going through your mind right now?
Just a lot. And that's awesome. I couldn't be more grateful. I'm just happy to be alive.
That's right.
Happy to be alive.
So you got hope, buddy. I'm sorry you've been through all this. Dr. Tareen, we can't thank you enough.